into, in lieu of time here, this is US specific. So for those who are international, we just wanted to talk a little bit about how this affects with Medicare in particular. We did have several questions that came in. There were patients who said, I didn't even think about anything regarding biosimilars. I'm on Medicare. I don't think this is a federal issue. So these are the things that patients said last week when I was collecting this. So I just wanted to know if somebody could weigh in a little bit on how all of this may affect Medicare. And then there's something else called the Inflation Reduction Act that we wanted to put on the table here, which we're actually going to do a spinoff on this topic, but we just wanted to put it out there to start the conversation, and then we'll do a whole other follow-up episode on this.
Well, I'll just start on the Medicare front and also the Inflation Reduction Act. We just actually had a webinar 2 days ago on the Inflation Reduction Act, which will be available on our website, that really went into not only, and for my personal background, I was actually in the department and helped in the secretary's office and the kind of creation and implementation of Part D. That's Medicare, basically, specifically for prescription drugs. And I think that in terms of the impact, there's a number of provisions within the IRA that are specific to biosimilars, and we will have a webinar on those upcoming. I'm not sure that they're all relevant for this conversation in terms of for your patient population, but clearly everything that we talked about here, the decisions that are made with regards to how interchangeables are treated will certainly be dealt with the same way within the Medicare population. So there's no difference. These issues absolutely affect you if you're in the Medicare population, no question. The one other thing that I did see a question of is, excuse me, there was a question about copay. I saw that one of your questions was about copay. Copay is a question that really is specific to the manufacturer and the product. So for any patient who's on a particular product, biosimilar, they should check with their manufacturer and find out what copays are available. They vary by manufacturer in terms of the amount of the copay, but most do have copay, cards with them. So that's just one other issue.
Andy or Dr. McKibbin, did you want to weigh in on anything else in regard to Medicare or the IRA?
Well, in terms of Medicare, so many people are on the Part C's, the Advantage plans. They tell you where to go and where to be infused, and substitution is part of that. I will say that there's a lot of federal issues looking at copay reductions and things like that. People should be looking at that and advocating and writing to their representatives and senators to make sure that those bills pass. The Inflation Reduction Act is really going to change the whole landscape for the way things are done. A lot of it has to do with payment, the 340Bs, are we doing underserved areas, and is the hospital making more money if they do the infusion, et cetera. And again, it's all complicated because the pharmacy benefit managers and the insurers and the hospitals are all blended together now. So you're never quite sure what you're going to be told to do and where you live. But I will say, though, that you will have coverage available. The copays, et cetera, are going to really just sort of be dependent on which plan you pick.
And can I just, with regards to the specifics, you teasing up the IRA podcast, it absolutely is going to change the game if it's implemented as it's been written. It will change the game with regards to what is available for medicines in the US going forward. Absolutely. And that was the focus of our webinar. It has an impact specifically as it relates to biosimilars, because it actually treats differently biologics and small molecules in terms of what when the manufacturers are going to be negotiating with the government. It's going to be establishing price controls in the US, and that means not a lot to a lot of people, but what it ultimately means is it has an impact with regards to R&D. It has an impact with regards to medicines available, and it's easily measurable because you simply have to look to Europe and the countries over there and the impact that they have with regards to access to medicines, new medicines, compared to us. And there's a significant difference And that's, to me, probably the most important thing for the patient population, is to understand that if it's implemented as it's been passed, we will have a completely different system in the US in the coming years.
Mhm.
Well, you answered the question I was just going to ask, so you're a mind reader.
The last thing I'll mention is that the IRA, we're very active in that. Do go look at the recording that was done yesterday once that's available on the microsite. That will have a negative impact on innovation, as Michael said, and have a negative impact even on the biosimilars marketplace, because what is the number one factor in every industry on the planet that lowers costs? It's competition. If you have one gas station in your town, they can charge anything they want. But if a second one comes across the street, the prices are going to go down. Right. If you have one supermarket, it's the same thing. So the last thing that we want to do is stifle innovation in the biosimilars marketplace. But if the government is setting the price of what reimbursement is going to be for a biosimilar, and I'm a biosimilar manufacturer about to invest $300 million, can I compete against what the US government says? There's no open market to compete against. The US government has said they're going to pay this, pay it, or I'm going to fine you and get you probably out of business for not accepting what I'm demanding you pay. It's essentially what the IRA says. This is not to spur innovation. If I'm an investor, I'm saying, whoa, I'm out of that space. I'm going to go invest in strip malls or parking lots or something else. So bad idea for patients. Anyway, we could go off for hours on that. Thank you for having me.
Absolutely. And then I know, Michael, you provided that ASBM has a microsite, the IRA patientinfo.org. So we'll make sure that we also put that at the end as a resource.